you're joining us. And with that, I'm going to turn it over to my brilliant colleague, Miss Inji Osman, who is going to take it over from here. Inji, take it away.
Thanks, Rebecca. So here is a quick overview of our time together today. We'll do a quick welcome and introduction and try to get to know some of you in this space as well. We'll give a few slides of background on community engaged research in this space, really just as a good grounding. And then we'll move into our panel discussion with time for Q&A at the end. As a reminder, our objectives for this presentation are that participants will learn about different community engaged projects at the intersection of the carceral system and reproductive health, barriers and facilitators to community engaged research within the carceral system, opportunities for change within research involving individuals impacted by the carceral system, and then finally, key concepts of community engaged research that folks can apply to their own work. So with that, we'll move into our welcome and grounding. We'll get more into our backgrounds and introductions during the panel portion of today's webinar, but just quickly, I want to note our panelists for today. We have Abaki Beck from the University of Minnesota, myself, Inji Osman from the University of Minnesota, Alicia Roach from the Oregon Prison Birth Project, Lisa Leavitt from Portland State University, Noelle Marsh from the University of Pittsburgh, and Carrie Cohen from Portland State University. We invite folks to share in the chat your name, affiliation, and what brought you here today. And we also have a couple of quick poll questions to get a better sense of who's joining us today. So we'll launch those quickly here. We'll get that going. Perfect. So folks could just take a minute to answer the poll, wanting to know what is your role within research teams, and then if you have any experience with community engaged research. We'll give folks a minute or two here.
Inji, there's a message in the Q&A that the chat is disabled, so it doesn't look like people are able to share their name.
Andrea, are you able to update that?
Yes. I will work on that 1 second.
Thank you. Okay, for now, we will be able to get a sense of who's joining us through this poll. I see there are a couple more people who need to fill it out, so we'll just give another minute.
Should be updated as well if everyone wants to give the chat another try.
Wonderful. Okay, we've almost got all folks. So I'm going to end the poll and just share the results. So we see what is your role within research teams? We've got quite a mix here. There's no real one dominant group. We've got research staff, a few community partners, a couple of lead or principal investigators, a good chunk of students here, and then folks who identify as other, which once it looks like the chat function is working. So anybody who kind of has that other, I'd love to hear a little bit more about where you're approaching the work from. And then, do you have experience with community engaged research? We've got a mix. We've got quite a few who are a yes, some no's, and some people who would consider themselves like having a little bit of experience or somewhat. So I think that's great. It's helpful to us to know kind of who's in this space so we can think about how we are approaching our conversation today. And with that, we're going to move into some background, especially for those folks who might not have as much experience with community engagement. So I will turn it over to my colleague Abaki, who will kind of start us through some of this background.
Great. Thank you so much, Inji. Yeah, so like we mentioned, we're going to move through some background slides to ground us in our conversation today about community engaged research with the carceral system. Do you want to go to the next slide? Alrighty, so to get started, I think it's important to think of community engaged research as a process and a set of values rather than a specific set of methods or a checklist that you can just walk through. The goal of community engaged research is to really actively and intentionally engage community members during the research process to create research that's both valuable to the communities that you're working with and centers the expertise of community members. And then finally, community engaged research falls on a spectrum. So approaches to community engagement that your team may engage with can depend on a number of factors, including the project timeline, funding, institutional barriers, etc. So this is a really great visual of that spectrum. I want to take a minute to shout out a really amazing graphic artist, Sarah Saltman, who we worked with on another project, who created this graphic for us. But essentially, all projects fall somewhere on this spectrum of community engagement. I like the concept of thinking of this as a spectrum because I think it helps people or organizations, assess where they're currently at and also think critically about where they'd like to be. And it serves as a tool of accountability and reflection. So there are 5 levels in this spectrum, and they constitute increasing degrees of community impact and engagement as you move from left to right on the topic that you're engaging around. So each level or point on the spectrum differs in terms of the level of influence that communities have on defining a problem or opportunity, on making decisions about the solutions to implement and how to implement them. But each of the steps along the spectrum is essential for building capacity for community collaboration. And this kind of spectrum format isn't meant to suggest that the left-hand side is meaningless. It's definitely not. Communities should be, informed, consulted, involved, but through deeper collaboration and relationship building, you can, co-develop and co-implement, solutions to community priorities and kind of move to a different point on the spectrum. And like I said, I think looking at community engagement as a spectrum allows us to visualize where we are and set goals for where we want to go as a collective. So we know there's not one definition of community. Every community is different. Every person in a community may define community differently. Similarly, there's not just one definition of community engagement, but one of our former advisory board members answered this question and said the following, quote, "Community engagement is where you meet the community where it's at. You bring your skills and talents to the community in an effort to highlight and build on the skills and talents of the community and its members. We are not voiceless. We just haven't had many opportunities to speak and be heard equitably. Community engagement changes that when it's done right," unquote. I think this is a really great definition, and something that we're trying to center throughout our projects is really to take a strengths-based approach and actively uplift the voices, skills, and expertise of those who are directly impacted. And now I'm going to pass it back to Inji, who's going to talk through some of the benefits and considerations of community engaged research, specifically for people impacted by incarceration in the carceral system.
Thanks, Abaki. So kind of building off of that foundation that Abaki just shared, there are a lot of benefits of community engagement and research, and specifically focused on our research around the health and well-being of people impacted by incarceration. Our project's Community Research Council, which I can share about in a bit as we dive into the panel discussion, they kind of co-created this list with us and described the benefits of community engaged research from their perspectives, and shared that engaged and accountable research can increase community trust. Research may have a greater impact when people coming from different backgrounds are involved, i.e. people with lived experience, people from diverse disciplines, not just academic researchers. Research based on community wisdom can lead to increased resources to communities, and research based on community wisdom can lead to practice and policy changes and really generate resources for community members to continue to advocate for change within and beyond the legal system. And this is a short list. There are many, many other benefits, but we're limited for time and space. So here are just a few key ones that our group described. But with that, what makes our work so complex and what I feel like is really the impetus behind this conversation is that community engagement when working with people impacted by the legal system is so different than community engagement in other settings. So the carceral system creates many challenges to actually implementing community engaged research and really actualizing these tenets and values of community engaged research that we hear and that we practice. So people in prisons and jails are subject to inhumane treatment, and the legal system is inherently designed to strip autonomy of people in carceral settings. The legal system is also very complex and operates on hierarchies, which can be really difficult for community organizations or researchers to navigate. And there's also a lot of rightful mistrust that people impacted by incarceration may have in working with B systems. So these realities deeply impact how participatory research may be able to be conducted in these settings. So in the next couple of slides, we have some examples of things we consider kind of more logistically here when partnering with currently and formerly incarcerated people. So when partnering with currently incarcerated people, there are some considerations here around departments of corrections or prisons and jails and institutional review boards or IRBs may see payment for involvement in research as quote unquote coercive, making it really difficult to equitably pay people for their time and expertise. Regular access to or communication with currently incarcerated people is also a challenge. We're often at quote unquote, like at the mercy of DOC or at, respective prisons and jails for scheduling, for access to technology, for example, like Zoom calls and more. Currently incarcerated people may face repercussions for honesty, especially if our research or partnerships kind of include evaluation or critical look at prison and jail policies. There also may be a risk of lack of confidentiality if research materials or engagement materials or feedback are being reviewed by prison and jail staff members prior to submission to the team. So there are probably a kind of innumerable barriers here that we, again, don't have the time or space to get into right now, but we'll dive into deeper in our panel discussion. But we also want to think about some of these considerations when partnering with formerly incarcerated people. So partnering with formerly incarcerated people, when we ask folks to participate on perhaps an advisory board or a community research council or a similar structure, it's a really large time commitment for people who are often already navigating many barriers as a result of the collateral consequences of incarceration, navigating these barriers both in their personal and professional lives. So some individuals, depending on their level of stability or where they are in their reentry process, they may have more time than others. And so researchers also really need to be intentional about striving for representation and ensuring that the board or council or whatever your group may be is not overly saturated by one particular type of experience. As we consider the collateral consequences of incarceration, there also might be challenges related to access to resources that might influence regular communication. So like access to a cell phone, internet, a safe and stable place to like participate in meetings from, things of that nature. And with that, people might need to rethink how research team meetings are held. So do people have access to a computer versus access to a phone? Is that compatible with Zoom? What about meeting in person? There are lots of considerations to take into account here. Thinking about how you're going to pay people. So is it accessible for people who don't have bank accounts, for people who may not have a social security number, a million other factors here about how payment can be oftentimes a barrier or challenge for people in its own right. And then similarly, there may also be repercussions for honesty. For example, if someone's on supervised release and we're being critical of a supervised release program, and there are kind of lots of considerations that might influence a person's willingness to participate in a group like this or willingness to speak kind of openly and freely. So these are just a few considerations that we all take into account in our work. And with that, this, again, beautiful graphic by that amazing graphic artist that Ibaki mentioned, helped illustrate this kind of graphic on this slide. So our team has created a resource guide in partnership with our Community Research Council that helps provide practical tools for engaging in participatory research with people impacted by incarceration. So our CRC, Community Research Council, helped co-create learnings and materials for this guide, and it kind of, as each section is broken out into different chunks, it includes an overview of each step of this process. So you can kind of visually see that here, walking through this little nature trail at the start and then through the finish of a project, although it's not always linear like this. But we talk about an overview of each step, reflection questions for researchers, example tools and materials that folks can use and apply in their own work, and then reflections from our community partners. So at the end of our presentation today, we'll share a QR code if people are interested in accessing these materials as well. And with that, I'll pass it back to Ibaki to kind of get us started in our panel discussion.
Amazing. Thank you so much, Inji. I hope that our brief presentation provided some helpful grounding on community engaged research with folks impacted by the carceral system, particularly for folks in the audience who may have less experience with community engagement or folks who don't have experience working in prison or jail environments. So now we're going to shift to the panel discussion. If you have any questions throughout the presentation, please put them in the Q&A portion of the chat, and we'll have a Q&A portion at the end of the panel discussion. All right, so we have an amazing panel. I'm very excited for this discussion. Could we begin by each of you sharing a little bit about yourself and your experiences at the intersection of community engaged research and learning and reproductive health in carceral settings? Inji, do you want to start us off?
Yeah, and I'm actually going to stop sharing my screen so that people can hopefully see us a little bit better, and you don't need to read panel discussion for our whole conversation. But yeah, my name is Inji. I use she, her pronouns. I am a staff member at the University of Minnesota in the Department of Pediatrics here. My background is in public health, specifically community health promotion and health equity. I work on a lot of different projects at this intersection of criminal legal system involvement and health. And most of our work is actually centered around children and families impacted by incarceration and maternal and child health. One project in particular I work on is called Enhanced Perinatal Programs for People in Prison, which is a mouthful, and we call it E4P. So you might hear me refer to that throughout the presentation. This project is a community engaged multi-site study that's exploring pregnancy and postpartum support programs offered to incarcerated individuals in several states across the country. And this work is guided by our Community Research Council, CRC, which I was mentioning before. And that is a group of formerly incarcerated people from across the country, many of whom experienced pregnancy or postpartum while they were incarcerated themselves and or work professionally in this space too. So our work in Minnesota is really informed by our CRC. We have a lovely group of individuals that we work with. And then our community engagement in Minnesota has also really worked to inform policy and practice in our state and beyond. So for example, the Minnesota Healthy Start Act, which I can share more about later on too, but kind of just a glimpse of some of these spaces where community engagement is really centered in our research and evaluation work.
Noelle, do you want to go next?
Sure. Hi, everyone. It's good to be here. My name is Noelle Marsh. I use she, her pronouns. I'm a PhD and PhD student in anthropology and public health at the University of Pittsburgh. And my research over the last too many years for my dissertation is a feminist ethnographic study of doula care, doula programs in US jails and prisons all across the country. And so while ethnographic research is maybe more on the left side of that scale that Inji and Ibaki showed us earlier, it is very much informed by interlocutors, by our participants, My research in particular was very much informed by conversations I had throughout the research process with folks that I was working directly with, in this case, primarily jailer prison doulas. And as a feminist ethnography, it was also very important for me to continue getting feedback, engaging in conversations during not just field work, but also data analysis and write-up, which is happening right now. I also can speak a little bit to some different modes of research program engagement that I encountered with some different prison doula programs, sort of leveraging those university academic partnerships to help move their work forward. And then finally, I'm also affiliated with E4P and Rebecca's team.
Elisa, do you want to go next?
Sure, thank you. Hi, everyone. I'm Elisa Levitt, and I use she, her pronouns. I'm an adjunct instructor professor at Portland State University, and I'm one of the instructors of the course called Current Issues in Pregnancy and Birth, Prenatal through Postpartum Support for Mothers During Incarceration. We'll talk more about the course and later in the presentation. This is a course that Carrie Cohen, one of the panelists, developed, and now I'm leading the course with her support. My background is in public health, and I am also an instructor at Portland Community College, where I teach in health studies. So one of the exciting things about this course, which is a senior capstone course, and I did see in the introductions that there is a student, I think at the University of Minnesota, who is also in a senior capstone course. So the course that is offered at PSU, it's an interdisciplinary course. And so we have students from all different majors, and we have a partnership with the Family Preservation Project, and they work really closely with people with lived experience and at Coffee Creek Correctional Facility. And so in this work at PSU, I help facilitate students in their community engaged work, and it's all around advocating for rights and well-being of incarcerated mothers and their families. Thank you.
And Carrie, would you like to go next?
Hi, everybody. Thanks for being here this morning. My name is Carrie Cohen, and thank you, Elisa, for giving some good background on the class. As Elisa mentioned, began teaching this class, the current issues in pregnancy and birth at PSU, probably back in around 2017, 2018, and through our partnership with Family Preservation Project, have had a chance to work on numerous projects to support women and their families during incarceration, and we'll be talking about some of those in more detail. But specifically, I'm doing a lot of research and literature reviews, focus groups, trying to really gather information on the need directly from people that are most impacted, and to help develop policy recommendations. We were able to work alongside Alicia, who's here on our panel, and the Family Preservation Project on several policy initiatives, and implement programs to help both with doula care and also with facilitating breast milk transport from women in custody directly to their babies, which we will talk more about later. When I'm not teaching, I am a lactation consultant with one of our major hospital systems. And so between education and lactation, that's kind of the place I come from. Thanks so much.
And last but certainly not least, Alicia, can you introduce yourself?
Thank you, everyone, for attending. My name is Alicia Roach. I'm a certified prison doula, certified lactation educator. I'm also a staff doula with Ostara Initiative, and I'm also the program manager for Oregon Prison Birth Project. I'm also a member of the CRC and site lead for E4P, and I've worked closely with Carrie and Alyssa with their capstone class to help guide the work through the doula program. Ostara Initiative is a nonprofit where OPBP lives, Oregon Prison Birth Project, and some of the other prison doula programs, and they also host the Advanced Prison Doula Training. And I've worked closely on the language for House Bill 2535 and doing testimony to help get that passed. And it passed in 2023. And yep. And I'll talk more about the program and all of the other things throughout the presentation.
Great, thank you all so much. So I think an important grounding question is why community engaged work and what are the values that you hold in this space? Alicia, do you want to get us started?
So I also have lived experience. I gave birth in 2009. So I know a lot about the other side of things, what I needed from my community partners and from the facility that I was at. So I wrote my first paper about doula care in 2012 before this program existed, before I knew that there was even prison doula programs. And I just felt alone doing this work. I would go up against people, not even go up against, but I would do testimony and share my story, and I didn't feel like anybody cared. So once I found Ostara Initiative, Carrie, Alyssa, Inji, Abaki, Noel, once I found my area of people, I didn't feel alone. And with the national people that I know, they were able to help wrap around the research, the information from the other prison doula programs to help get our bill passed. So having community engaged work shows people that we can come together and we do have the knowledge and show that these programs are needed.
Carrie, do you want to go next?
Sure. So I feel like, service learning models and community engagement models are essential for creating programs and services that will meet the goals, right? So it's essential that we're really taking the time to listen and center the voices of people that have lived experience, and particularly that are going to be most directly impacted, both in the development of making sure that what comes out of the research is applicable and meaningful, but also to create that connection and relationship with, in our case, when we're working with students at Portland State, some of our students have experience interacting with carceral systems or family members who have, and many do not. And so there's a good deal of learning, what does it mean to be impacted by the carceral system, or to be a parent and who's impacted, or a child who has a parent who's incarcerated. And I think it's essential that we're taking this, the work that we're doing away from statistics and generalizations, and making sure that that we're seeing our community partners and seeing the humanity in each of us, to make sure that the work we're doing, both, like as I've mentioned, I feel like I'm repeating myself this morning. Sorry, I'm a little nervous, but just to make sure that there's a home for it that will actually serve, its intended purpose. So, but I think that, as you mentioned earlier, I can't remember who mentioned it earlier, maybe it was Abaki or Inji, one of you, about the importance of building relationships. That's key to any of this work that we're doing, and to just see all of each other as people working to create positive changes. And so that, for me, that's the grounding in community engaged work.
Elisa, what are your thoughts on this, particularly as someone who's working with students?
Sure, thank you. Well, Carrie did a nice job responding to that question. I can just add a few things that with community engaged work, I'm like, why wouldn't you use community engaged work and these participatory methods? And, rather than coming in and suggesting solutions, you're having people with lived experience that can can share the solutions and what they need most. And that's why also we value so much our relationship and partnership with the Family Preservation Project, because we listen to them and what they need, and then we create projects to help support them with their work. And again, with the Family Preservation Project, their hope is to really help maintain that women who are incarcerated at Coffee Creek, that they're able to maintain really strong relationships with their kids through a variety of different supports. And so the students are also really involved with advocacy in this course too, which is a great component of community engaged work as well. And then another piece of this class I mentioned earlier is that it's interdisciplinary. And so I think that that's a really great like value kind of to mention, is that you're including voices from a variety of different areas. So for example, we have students, some criminal justice students, some psychology, public health, nursing. And so you're getting all these different perspectives whenever we're working on a project. And it really lends itself to make sure that all voices are being heard, all perspectives, and then they come up with some amazing project kind of based on that expertise. Yeah, I mean, and also with community engaged work, that, you know, they're able to work on like social action, you know, they're able to work on social change through this collaboration, commitment to equity, et cetera. Yeah, I think that's it.
Thank you. So shifting more towards kind of academic research, Noelle, could you talk about this question kind of in your own research and dissertation experience?
Yeah, thanks. So I think it's important to start from this baseline, which Abaki and Inji, you sort of said in the beginning presentation slides, right? This premise that incarcerated populations are already extremely marginalized, right? They're facing multiple levels of oppression and stigma and dehumanization, and are almost never engaged in these research and policy conversations. So from a feminist ethnographic, anthropology background, attending to power dynamics is huge. It's very much at the foundation of what we do. And so thinking about how research and research participants, what does it mean to sort of blur those roles, recognize that interlocutors are, in a sense, co-researchers or collaborators, thinking about what it means to do research and how that sort of maybe reproduces certain social patterns, right? Like maybe reproduces those hierarchies or not. And, as Elisa and Carrie mentioned, right? Like what are the outcomes? Who is this research for? What are the benefits? Who's going to be getting the results? Something that we think about a lot is the importance not just of centering the margins, which comes from Black feminist theory, right? Which is the sort of premise that to understand or solve social problems, you have to really emphasize and amplify the perspectives of folks who are on the margins. That has to be central. So we have this, right, sort of foundational drive, and then, but also this notion of studying up, or what I think of as sort of studying the middle, because sometimes you have to study up, study those systems of hierarchy to really understand how these power relations are happening. So for me, right, like thinking of all those things together, but also in tension, that sort of drives my work. And in my project specifically, I felt like I was sort of doing a studying the middle, where focusing on doulas, because as a PhD student, right, you're also in a different position where you maybe don't have the training or the experience right off the bat to do community work and to do it well, right? Because, and some do, right? Not to dismiss that, but I think it's really important when doing community engaged work, especially with marginalized populations, right? To be very attentive and sensitive to all of these different factors that folks have been bringing up. One more thing I'll just mention too is that in academia, if you're in a tenure track, or if you're in, sort of those positions, community engaged work is not necessarily rewarded. And so that's another barrier to actually making these things happen. It's not rewarded in terms of funding necessarily, or in terms of, going up the tenure ladder. So I'll stop there.
Thank you. And Inji, do you have anything to add?
Yeah, just really quickly, thinking about, why community engaged work, just echoing what other people have said, like, why not? Like, it feels so obvious and so important, but yeah, we really aim for our work to be strengths-based and really build off the expertise of community members. Centering in this work, we know that people with lived experience in the criminal legal system are aware of the problems at hand, and they have the answers and solutions to these problems, as well as an incredible amount of knowledge and strengths to leverage, but really lacking sort of some of those resources or, institutional momentum to actually be heard equitably. And so I really view our role in research at a university as working to leverage the resources of our institution to do this work, but really recognize that it's so important for the work to be guided by people who have been directly impacted by incarceration if we want the work to be responsive, aligned with community priorities, and impactful. So that is kind of our why.
Great, thank you. So thanks for talking through kind of your experiences with community engaged work and the values that center this work. Noelle started to talk about this a little bit, but could you talk through some of the barriers you've encountered in this work related to community engagement within the carceral system, and what are some of the ways you've worked to overcome those barriers? Inji, could you get us started?
Yeah. I'll keep it brief because I know other people will probably touch on other barriers. But I think just the overall barrier that I alluded to as we were talking about considerations at the start was how community-based participatory research constructs, so things like shared power, mutual benefit, like trust, those sorts of constructs become really challenging to uphold in a system that regulates access and participation in research, and that also works to rob people of autonomy and agency. And so is it possible to have shared power when there is inherently a power dynamic of somebody who is, for example, currently incarcerated? Like, how do we work to actualize those constructs? Or maybe we can't, and we have to be transparent about what we can uphold and what we can't uphold in these spaces, in these unique considerations. So those are some kind of really big high-level barriers that I think about often. And then a really practical barrier that I deal with maybe more than I would like is that the university system, so kind of approaching it from my space in academia, the university system makes it really difficult to engage with community. So they oftentimes really say that they value the work, but the policies and structure and bureaucracy that's in place makes it really difficult to authentically engage. So for example, having really rigid payment structures that can't meet community members where they're at. So for example, we've had to fight and push back against some things where it's like, you can only use this specific like gift card to pay people, but maybe the store that we're buying the gift card to isn't something that's accessible for people or something that they regularly use or like shop at, things like that. So we've had to kind of push the system to allow us to do things a little bit differently, but also we are pretty regulated by the policies and systems in place. So like, I would love to pay people in cash. We're not there, and I don't think we'll ever get there at the university. But we found some options and really try to give people as much choice as possible in how they want to be paid with the options that we have. So trying to promote like that autonomy wherever we can. And I think other people can probably get into this as well, but also kind of thinking about university barriers around the institutional review boards or IRBs. We've run into some considerations or challenges or pushback around the IRB having really rigid views of like researcher versus subject, and what happens when the quote unquote subject, which is the person whose experiences we're wanting to understand, is also involved in the research as a researcher. And that's something that we're still trying to navigate in terms of processes for that engagement without being an actual staff member at the university, and also wanting to move to a space of hiring folks as well, and all of the barriers that come with that. But we are currently still navigating some of those IRB considerations. So I don't have some lessons learned there quite yet, but just really thinking about the ways in which these rigid structures are kind of antithetical to what community engagement is supposed to be.
Yeah, absolutely. Noelle, do you want to go next?
Sure. Yeah. Just to kind of add to some of what Inji was saying, which definitely echo challenges with IRB and, sort of like really rigid ideas about what research looks like and who's doing it. Something that I benefited from in my position, but also found is really challenging is just the amount of time it takes to build relationships in these settings. Because you have to build a lot of trust. And that's not just with, currently or formerly incarcerated folks, but if you're trying to get access to carceral facilities, community organizations who work with folks on the inside, that can take time. Folks are really busy, you may not get answers. Different carceral facilities may or may not be as open to researchers. Or one thing I found that was interesting is some facilities that are open then sort of get all of the requests, right? So there's sort of a saturation of researchers approaching certain folks or certain sites. A challenge again, grant funding and university expectations about timelines for completing projects. And the time thing, it's not just about building trust, it's also that this inevitably should be a longer term relationship, right? If you're doing really good community engaged work, it's not just showing up for this one project, doing it and saying, bye, see you later, right? It's being there and staying engaged for as long as possible. And so that's something that, folks, we try to work around in different positions. Like I said, as my position as a PhD student in an anthropology department, there was sort of this understanding that this was a longer term project. And so I had the benefit of being able to spend quite a lot of time doing that. But again, it really depends on where you are. And one thing I'll also just note is that, carceral systems are challenging to enter in the sense also that there's this primary emphasis on safety and security over everything else, right? And what does that mean? What does that look like? There's a lot of high turnover. There can be a lot of inconsistency, right? There can be the sense that there's no room for you to make a mistake or you're out. And so it just feels like really high pressure stakes, and programs express this as well, right? Like you do one wrong thing and the person says, bye, you're out, you're done. And that can be really hard to navigate. And unfortunately, I don't think there's a good way to like solve that if you're in that position, because again, there's these power differentials where the warden or whoever has that decision-making power. So I'll stop there.
Thank you. Alicia, could you talk through some of the barriers from your perspective or that you've encountered in your work?
Yes. So some of the barriers, they really stem from medical is operating on medical terms. DOC is safety and security, like Noelle mentioned. And as doulas, we're like, we need to advocate for everyone. This person needs this person needs that. And so we're coming from a person-centered approach. And just, it's all about relationship and trust. And building that trust within DOC, it takes time. And it takes a long time to build that trust. And so I just show up and be willing to learn from them as well as them learning from me. But it's really about trust and trying to shift each system into thinking differently, which systems have been how they are for many, many years. So for instance, nursing bras, when I'm choosing nursing bras, I'm looking at choking hazards, metal pieces, and how many they're allowed to have, and just all of those different things before I even make a purchase for something that our clients need. And then asking security staff, what do you guys need these things to look like in order for them to come in? But I continue to show up, willing to learn, asking questions, and also like figuring out what questions to ask, when to ask them, and how to ask them is super important, because that pressure of, ooh, I know that this is a thing and it happens, and I know that there's an easy fix, but is this something that I want to ask right now? And so I reach out to my network a lot, like, how do I ask this? These are the things that's going on. But building trust, coming in with a smile, always asking people how their days are doing, what's going on, how can I support you guys, and just really focusing on building that relationship. Because once that trust is there, we'll be able to navigate and get rid of some of these barriers so our program can be as best as possible.
Thank you. Elisa, what are your thoughts?
Thank you. Wow, there's so many different directions I could go with this. I'll just echo about building trust and building relationships, and that all takes time. You know, each term that we teach this course, and we work with Coffee Creek, we are collaborating a little bit more, but those things just take, you know, it just takes time. And then also, you know, we've had a great relationship and partnership with the Family Preservation Project and with Astara. And so just like, you know, continuing to grow those. And then I'll kind of narrow the response down a little bit, specifically with our course when our students are working on projects. So at Portland State University, we're on the quarter system. So we only have like 10 weeks to work on a project. Senior capstones are intentionally small as well. So we have 16 students in each class, and it's only offered twice a year. And then as you can imagine, the first 5 weeks of the course or so are really like setting it up. So they're learning about equity and systemic racism, and you know, they can't really start working on their projects until they have that background information and how to be trauma informed, et cetera. So then it's really only a couple weeks to do some amazing projects. So biggest barrier is that there's more work to do than we realistically have the time for. But we're doing, you know, we get around these barriers by continuing to build those relationships. You know, also the Family Preservation Project has interns that help the students with the projects as well. So they're getting direct feedback, and we have some really cool projects this term working on and last term, like stigma reduction campaigns, developing policy advocacy materials, working on how to make visits to Coffee Creek more family friendly, and then educator toolkit. So helping to put together materials that would help instructors better support children who have parents who are incarcerated. That's it for now.
Great. Carrie, what are your thoughts?
Yeah, I think, you know, trauma-informed principles need to be underlying all of our work. That includes both with the women and families that we're working with who are impacted by the carceral system, but also with our community partners, with the DOC. I guess that they're also one of our community partners, but just especially in that being able to be very forthright, consistent, making sure that there are lasting relationships. I think when I first started this work and first started talking with Jessica Katz, who's the executive director of the Family Preservation Project, she shared with me how many times in the past, right, there had been interest of things, you know, you get these little spot up, you know, little like interest bubbles of like, oh, I want to do a doula program, or I'd be interested in this, but then they would kind of run into the barriers and disappear, right? And especially when you're working with a population, with a community of people who have had, you know, an excessive amount of trauma in their life, who are currently in a traumatic environment, being able to show up and be present and stay present and create those lasting relationships is key. The other thing I wanted to mention, the other barrier that we ran into when we first started looking at, how do we assess the need for a doula program in particular, or for a milk expression support program, was not only in access to being able to talk with the women at Coffee Creek who were directly impacted, but also the consideration of not wanting to add to the trauma, right? Not wanting to put people who are already in an incredibly challenging place into, asking them to talk, relive their experiences, ask about, that would create, put them in a more vulnerable place without being able to offer the support resources that need to come with those questions, that come with that assessment. And that that kind of guided us towards work, primarily working initially with people who were formerly incarcerated and who had had experiences and were now in a different place in their lives and open and willing to share with the class or participate in focus groups or questionnaires or phone calls. But I am very hopeful now that we have our additional partner of an existing developing, doula program on site that is also engaging in those long-term relationships and creating that trust, that we'll be able to have a better, way to access and assess the needs as you're hearing them directly from the moms that you're working with, and being able to integrate that, just as the Family Preservation Project has been able to do. Just for the background that folks don't know, if not on the call, the Family Preservation Project primarily works on the minimum security side, and most of our moms who are pregnant and newly postpartum are over on the medium side. So there was this physical barrier as well that came in, and so again, kind of impacting the ability to gather data, or not just data, but experiences and needs assessment. So things are always developing, always growing, but yeah, the trusting relationships, and then being able to support Alicia and her team as she's finding out what the needs are and growing, will continue to support that work.
Amazing. So it sounds like some of you, well, all of you, have faced real challenges in this work, barriers in this work to, intentional, trauma-informed, and community-centered engagement. But could you talk about some of the success you've had in this work that you want to uplift as it relates to community engagement and community partnerships? Alicia, do you want to start us off?
So this was always a dream many, many years ago. And my son is 16. So I've dreamt about this program, and I get up every week and I go to the facility, and I actually have a program here. So that is super huge. I'm not alone. I have national partners and partners that support me, support this work. And I don't have to retell my story or make people understand why this work is important. My people came to me knowing that this work was important. So I'm just not alone. And we have a program. Our moms on the inside are not alone. They have support walking alongside of them. So those are my successes.
Amazing. Ingie, do you want to talk about some of the work in Minnesota?
Yeah, I think just broadly, some of our biggest successes have really just been around relationship building within our Community Research Council. We've had lots of iterations of community engaged groups over the past decade, but our Community Research Council is one that we are working to continue to sustain moving forward. We've been together for a few years now, really brought together around our E4P project, but now really informing lots of different projects and areas of work that we do. And we brought people together from across the country who, some of us knew each other, some of us didn't. And the relationships in the group and our relationships with members of the group has just been so impactful. Even doing it via Zoom, the support and care that everybody has for one another is just so palpable. And then when we've gotten to be together in person, it is just so magical and special. So a lot of successes just around the relationships that feel the most important in this work. And then just some quick policy successes too. our community engagement work and our research has informed Minnesota policies. So I mentioned the Healthy Start Act early on. That is a policy passed in Minnesota that allows our commissioner to release pregnant and postpartum people into community-based alternatives. So kind of releasing people who are pregnant and postpartum from prison. It's great in theory, and our engagement with people with lived experience has made this possible through research, testimony, listening sessions, and now our community engaged work is also informing the evaluation of this policy and recommendations for this policy. So our CRC has been really involved in that process, and we are putting out a report of recommendations and areas to keep improving this policy that is a great start, but really far downstream. So really, I think our community engaged work, which is at the center of our values, is systems change and advocacy. And I think we've been able to start that process and continue on that process in our state and beyond. So feels really important.
Amazing. Thank you. Carrie, can you go next?
Yeah, so I think a couple of successes. The class was able to be involved in helping to gather a lot of the just doing research into other national programs around doula work, and help gather information to facilitate the development of House Bill 2535, the doula bill, and support it as it went through its legislation. But I also want to talk about the Expressions of Care program, which was kind of came out again from moms at Coffee Creek sharing their barriers to being able to express breast milk for their infants, and then get their breast milk to their babies. They're running into a lot of barriers as far, we have one women's prison in Oregon. It's up here in our northwest corner. And if you are in, Eastern Oregon, Southeastern, or either just Southern Oregon, transportation barriers, financial barriers. Moms were being asked to have their milk picked up by a caregiver once a week. They had to pay for milk collection bags. They weren't, and again, when you're trying to balance money, resources, and phone calls or video calls and milk collection bags, there was just a lot of financial and transportation barriers, access to pumps or timely access to pumps that were coming up. And so we were able to help facilitate a partnership through our class with the Northwest Mothers Milk Bank, who has a human milk banking program, is in the business of shipping milk every day to NICUs and other facilities in need. And so they hopped on board and kind of created this little trifecta partnership then with the DOC to help create a partnership program where the milk bank now comes to Coffee Creek once a week and picks up the milk, and they've built lasting relationships over these last several years as well. So they are able to pick up milk and ship it directly from moms to their infants. It's a separate program from the milk banking program. But they also do things like provide collection bags so that parents aren't having to pay for those on their own. And they, as this program has grown, provide a lot of caregiver support, which is unexpected, but also very exciting. They're in regular contact with the caregivers of the infants to answer questions about milk storage, or just to check in every week and see how things are going, and to let them know if milk is, when milk is being shipped out. So it's been really exciting to watch it kind of grow and take off. And then just one last little thing too, I would say is one of the successes. We took this group of students out to visit out at Coffee Creek just to get a sense of the lay of the land. And we were able to actually meet with the OB this time. And what was really exciting is that they were the ones talking about the Expressions of Care program, right, and the doula program. So it was now coming from within Coffee Creek, and that was very exciting to hear.
Thank you. And Elisa?
Thank you. And thank you, Carrie. She did a nice job sharing how community or students kind of community engaged work has directly contributed to real world change, which is pretty awesome. And it's also really cool for students to think about how they can take what they learned in this class and then think about what that means for them in the future. So kind of beyond those kind of tangible outcomes, like a really deep success is that students leave the class like a little more informed, transformed. You know, they learn more about advocacy, equity, and really systemic change. When Jessica Katz, who, as Carrie mentioned, is the executive director of the Family Preservation Project, she and her team always come the first couple weeks of the class to meet the students, and they always are so inspired every time they come. And one of the things that she likes to ask students is, what is prison for? So the students just take some time, write out their reflections, like what are the first things that come to mind? And then at the end of the term, they revisit that, and when they write a reflection paper, and it's pretty amazing to see how students' ideas and thoughts about reproductive health in carceral settings, people who are incarcerated, like how those things have changed. You know, like Carrie said, some students have had a little bit of experience, but for many, they'd never thought about this before. They never thought, you know, what happens when a woman is pregnant who's incarcerated? And so then they come out with a completely different idea and desire to change. And so again, they kind of take what they've learned here, and then they think about how can they incorporate this into whatever settings they go into professionally in the future.
Thank you. And Noelle, what are your thoughts on this?
Yeah, thank you. So I'll just speak to mostly my experience of doing the research so far, since I'm not yet fully at that point of dissemination, and sort of seeing some of those impacts. But being able to do like ethnographic fieldwork, one way that I was sort of collaborating was giving back my labor to the programs that I was working very closely with. So basically acting like a little mini intern and doing whatever I could in my role to support them. And so that was, you know, just in small ways, like one of the programs I was working with, they were actively trying to get their doula support back off the ground. And so we had a presentation to DOC, and in my, you know, sort of position collaborating with them, was able to say, here's the research, here's what other folks are doing, and sort of help support them in that way, coming from, you know, a university position, because again, sometimes those letters behind a last name mean something, even though, you know, we should really be valuing lived experience and other types of experience just as much, even if it's different. But in these systems, you know, a PhD or getting a PhD means something, or having that university affiliation means something different. So like Inji, I think, said earlier, really leveraging those resources and leveraging that position to help support folks who are doing work on the ground. Another model I came across actually that I thought was really neat, one of the prison doula programs, or a lot of them really are very careful with advocacy, right? Because you don't want to make the wrong people mad. But there's a Michigan student group that does a lot of that advocacy. You know, they're doing the research, they're doing advocacy, they're talking to policymakers. So thinking about, again, about how sort of different partnerships can be leveraged. I'll just mention real quick also, one thing I've really appreciated in my work of connecting with folks who are doing reproductive health doula work across the country is then getting to help connect people to each other, which a lot of times they're sort of doing organically, but I have really seen through my involvement with like the National Network of Prison Doula Programs, helping facilitate that, you know, people like in one city might be like, oh, I thought I was doing this work alone for years and years, and there's this whole other group of people around the country who are also doing it. And so that's been really exciting for me to sort of help be able to facilitate and connect people to each other, and then to be able to reflect back informally so far their experiences from the data that I've gathered, and sort of affirm, you know, what they're experiencing through the research. So thank you.
Thank you all. So we have one final question for the panel before opening it up for Q&A, and that's what next? Where do we go from here, and what are your dreams for this work? Alicia, do you want to start us off?
I dream pretty big. We just need to, if we're not going to stop locking our pregnant people up, we need to have housing for them. Continue to involve community partners. Without community partners in all aspects, this work can't happen right. We need the researchers, we need the milk banks, we need the PhD students, we need prison doulas, we need the prison doula trainers, we need DOC to be able to be open and willing to partner with us. So just continue to spread the word, build our network, build our national network, and eventually stop locking our moms up.
Absolutely. Carrie, what are your thoughts on this?
Yeah, so I'm hoping going forward in the future. So here in Oregon, we have the Bill of Rights for Children of Incarcerated Parents, and that's kind of grounded a lot of the work, or that we've been doing has kind of stemmed from that. And some of those rights include being able to see and touch your parent, to have a lifelong relationship with your parent, to be cared for, all these things that are so essential. So I'm just going to echo what Alicia was saying about, like, can we look at community alternative sentencing? Can we look, ways to keep families together? But beyond that too, looking at with just in the immediate future, other ways to implement the Bill of Rights. So can we increase transportation options to get in-person visitations, to help facilitate in-person visitation, or financial support for video calls? Of course, that in-person would be ideal, but also looking at how do we support families even just at the time of arrest, so that children are being supported? Can we integrate more social workers in with our with the police at the time? There's a lot of different directions this could go, but there's a lot of work still to be done. And then I think more broadly, just looking at social stigma, because I think that really drives a lot of the policy work. And so finding ways to address social stigma towards parents that are in custody, and finding ways to again, just kind of see each person as a human and a family, as someone who wants the best for their kids, and how do we support them.
Thank you. Elisa?
Thank you. I don't know if I have too much to add, except on my end, just creating student projects that help support all of the work and the ideas that Carrie mentioned, how to implement the Bill of Rights and evaluate its, what's happening, what's not. And then also supporting Alicia's dreams and Ostara's dreams as well.
Thank you. And Noelle?
Yeah, I think on the university side, I would really like to see there be more training, more emphasis on community engaged projects. Where academic institutions are not just being performative, because I think that is really, as Benji was talking about also, that's what we see a lot of times is performative, but really digging down and saying, how do we actually leverage, again, resources and structures to support people's needs, and not just what the university needs or wants. In the short term or more immediate term, I think I would really love to work with prison-based peer doula programs, where folks on the inside are also being trained to be doulas, or to be doulas to each other. And I think in the long term for this work, also echoing Carrie, like this issue of stigma, and I think misconceptions about what is actually needed to support families, so that families can, like in reproductive justice says, like have children or decide not to have children, or have children that you can raise and be healthy and live long lives. you know, what does it actually take to make that happen? And it's not just sort of this very individualized idea of bootstrapping and such. And again, for families who are facing structural violence, who are systems impacted, how do we really sort of radically change those systems or reimagine those systems, I think, to do better. And I think, as Carrie also said earlier, like really recognize the humanity in each other, and have better ways of addressing harm, because harm happens, right? But how do we not keep harming as we address it? Thank you.
Thank you so much. And finally, Inji.
Thanks, Sabaki. I would just echo what everybody else said. I mean, really big dreams around systems change and upstream solutions and support, like putting our public health hats on and really thinking about how do we support families and community before, like, so the legal system is not even an option, right? Kind of thinking short term about our work. Our plan is to continue facilitating our CRC for the foreseeable future. We've been really lucky to be able to obtain multiple funding streams to kind of weave together to support this work across multiple projects. So that's very exciting. We're continuing, I mean, committed to lifelong learning here. So continuing to refine our methods of engagement, always striving towards more power sharing and resource sharing. We do our best and we still have a long way to go. So lots of dreams there. And then finally, I will share my screen here too. We're working to develop a resource guide focused on conducting community engaged research with this population in the hopes of supporting capacity building across organizations. So kind of hoping to get at some of those training things that other folks have talked about, recognizing a real gap in resources, particularly for this population. So I will leave this up if anybody wants to scan the QR code and get on our mailing list, or you can visit that link, and I think Andrea will drop it in the chat as well. But yeah, so that's kind of what we're up to right now, and then where we're looking ahead.
Amazing. Thank you so much to all of our panelists. We're now going to open it up to the Q&A for the next couple of minutes. Folks have already dropped some questions in the Q&A. I'm not sure if we'll be able to get through all of the questions in the next 15 or so minutes, but I'm going to try to group them together around common themes. And please feel free to add more questions to the Q&A chat as well. So one thing that came up a couple of times is, what advice would you give to early career scholars and researchers who are passionate about community engaged research, but are concerned about how it might be viewed in tenure evaluations or in academia more broadly? Do folks have any thoughts on that?
Noelle, I feel like you might have some thoughts.
Yeah, well, I was just thinking that's a hard one because I'm definitely not in a tenure stream position right now. Um, yeah, I mean, I think it depends on a couple things, right? It depends on your department, it depends on your university, because I imagine some places will be more accepting of community engaged type projects. I think especially if there's more of sort of a broader social zeitgeist into, you know, incorporating those types of projects. I will just say from the, you know, a lot of my mentors and professors who are doing this work, unfortunately, a lot of times it is kind of their side projects. It's not their, you know, main publications, their main manuscripts going out for 10 years. So I think part of what has to happen is sort of this continued push and advocacy, and maybe that is happening, you know, for folks within departments saying like, hey, like I'm doing this engaged project, you know, how can we work with the chair, how do we work with the department, the dean's office, whatever level you have to go at to make this count, right? To say that this is just as valuable as whatever other sort of requirements there are. I think that has to happen, you know, sort of from more of a top-down university level. So I'm sorry, I don't have more concrete to offer there.
Yeah, and I'll add in a couple of things that I've heard. Again, I'm not on a tenure track, but some things I've heard from my mentors as well has been like, yes, there are requirements that you have to do and do them, but what are you going to do beyond that in terms of dissemination for the buy-in for the communities that you're working with? So publish that paper and check that box if you have to, but also that is not where our dissemination stops. That's not where our engagement with community stops. How can we actually use that as a tool for action and change and get that information back to the communities? Another thing that I'm thinking about too is like in the areas that you have to check a box, can you also do it in a community engaged way? So we've had community partners be co-authors on papers, help inform our papers, co-present at conferences, like do all the things that you need to do, but are there ways that you can embed values or tenets of community engagement even into that work? So trying to get creative with it. And unfortunately, there is like so much unpaid or unhonored labor that goes into it versus our colleagues who are just publishing papers, and that is the end goal. And community engagement taking that multiple steps further. So that's one thing I'd think about there. And then Abaki, to kind of the other part of your question about advice for students, I would say just really come in open to learning and growth. There's so much that you have to learn from your community members that you want to work with and your community partners, and really spend time in spaces just learning and just listening without an agenda or a research question or anything of that nature. So my biggest advice is like, as a student, it's a great time to like embed yourself in community and learn from others.
So this kind of goes along with what you were just saying, Ingie. Another person asked, how do you build trust and relationships with incarcerated and formerly incarcerated people? And how do you work to eliminate or navigate negative power dynamics?
Alicia, do you have any advice around building those relationships?
I was just thinking, I've always felt heard from you guys. So making sure that you are honoring and respecting this person's time and just this person as a human, just mutual respect. Yeah, but I've always felt seen and heard from you guys. So that's the hugest thing. And you guys don't do anything without, like, if my name is on a paper, you're not like just putting me out there on blast or using me as a trophy. So just making sure that you are intentional when you are interacting with this person. Yeah, and share some of who you are as well. That's important to help build trust.
So, oh, go ahead.
I was just going to add, and I feel like, and we talk about this with the students as well. Like, I think you got to come to this work as collaborators, equal collaborators, right? That's we're all doing this work together.
Absolutely. And a more specific question, but related to that someone asked, is what does equitable partnership look like with system impacted individuals and organizations in your research? So do you have any practical examples of what that looks like in your work?
I don't want to talk too much, so if anybody else wants to go, please do.
I just wanted to, I guess, in answer to sort of both questions, although it's sort of more of a high level, but I'd say showing up, being consistent, as Alicia said, being intentional, really acting with integrity, investing in those long-term relationships, being honest about what you can deliver, and having those sort of honest conversations about what would be beneficial to the community partners, right? Saying like, how do we center your needs or desires in this work? Really being careful about trauma-informed approaches. like I said, that's sort of high level, but I would say that's really the basis for, I'd say, developing trustful working relationships.
Yeah, and to add about like what equitable partnership looks like, I think it looks like all those things that were mentioned by Noelle and Alicia. One big piece of this too, kind of getting at some of those tenets again, like mutual benefit and shared power, like what does that look like in these relationships and these partnerships? For us, it looks like really coming back to our community research council early and often. So like in some cases we're limited and pulled in people after grants were written, but oftentimes we look to this group for future research priority setting. So where do we go from here? You are an active decision maker in what we get to do moving forward. If we have a grant opportunity, bringing it to this group for their input and wisdom as well, and deciding whether or not we want to pursue that together. Another big piece of equitable partnership is paying people for their time and wisdom and experiences. So that is just another huge component of this too. Like if we're being paid for our time as researchers, but we're just capitalizing on people's free time and just their wisdom and not valuing that as a knowledge system and not valuing that as an equal partner through payment and honoring that time. Yeah, so just thinking about those couple things in particular.
Absolutely. And maybe the last question to ask before closing out is what keeps you all going in this hard work?
For me, I know that I have a lot of stuff to teach from my lived experience, and if I'm not going to do the work, who's going to do the work? There's a lot of people, as you can hear one of my kids in the background. There's a lot of work that needs to be done, and I know that I know what I'm talking about, and why not share the truth? And just to see how far we can take this work and if we can have community alternatives.
Yeah, I think, sometimes the students will remark that it feels a little bit like drowning. I had one student described as, as they were getting into understanding the scope of, all the different pieces that impact women and families during incarceration and some of the barriers that come up during this work. And they felt like, God, they're like, it feels like I'm walking up a sand dune. And every time I take a step, I'm like sinking in and falling backward and the sand is coming in on top of me. And I had another student who, she has, a couple of family members impacted by incarceration, was the foster parent for her sister's babies, and went on to be instrumental in helping to create the Expressions of Care program and working as a milk bank and returning as a community partner to our class. And she would just always remind students, if you can make life better by 1% for 1% of people, even just that, like that little bit of change, like is worth it. And then we build from there, right? So I feel like you always, we've got to go millimeters, right, to go miles. And it does sometimes feel like it's a slow trudging journey, but things do happen and it just takes commitment, and it is worth it if you can make life better.
Okay, Abaki, anything else you want to add before I close this out?
I don't think so. Thank you to our amazing panel. Thank you to everyone who joined us. I know we have some resources and other stuff to share. But yeah, thank you all.
Great. Okay, so I'm going to share some resources real quick. I shared this earlier, and we also threw the link in the chat for anybody who is interested in receiving a copy of our resource guide. Please fill out that form and put yourself on the mailing list. There are also some upcoming events. So JIWC is hosting another webinar on May 13th, focused on the Minnesota Healthy Start Act, which is something that I mentioned a couple of times throughout our time today. So please feel free to get registered if you'd like to join us. Finally, just want to thank again everybody for attending, for your time and questions and really thoughtful engagement. Special thanks to our speakers and our moderator, Abaki, and thanks to our speakers, Alicia, Elisa, Noelle, and Carrie. Finally, recordings and future webinar dates can all be found on our website, which we'll drop in the chat. And please, if you have a minute or two after, please fill out today's webinar evaluation. We'd really appreciate that as well. So that is all that we have. Thank you again for joining us. This was a really great conversation, and we are grateful that you all were able to take some time and be a part of it.